Dear learners, today you will learn about emergence and re-emergence of disease. Myself Dr. Netran Sahu, Department of Geography, Delhi School of Economics, University of Delhi. So, today outline of our study, like it will contain introduction, historical context, factors contributing to emergence of disease, then factors contributing to re-emergence of disease, emerging disease in India, re-emerging disease in India, then also we will go for global perspective on emerging disease and global perspective on re-emerging disease, impact of emerging and re-emerging disease, then organization involved, some case studies, conclusion, and we will provide some references and very good readings and also some of the websites where you can get the data. So, the learners outcome by the end of this presentations, learners will able to learn like recognize new and re-emerging illnesses, determine past epidemics, examine contributing elements, analyze the Indian situations, recognize global trends in disease. Evaluating the impact of public health, recognize the advance in technology, determine persistence difficulties. Also, learners will get to know the organization involved and recap main ideas. Let us start the lecture. Introduction. Emerging disease. New infections caused by changes or evolution of existing organisms or those spreading to new regions of populations, and re-emerging disease like known disease that have returned after a period of significant decline, often due to factors like antimicrobial resistance or public health breakdown. Global health threats have profound impacts on public health, economies and societies. Therefore, there is a need for effective surveillance, preparedness and response strategy. Environmental change, for example, deforestation, climate change, increased global travel, urbanization, antimicrobial resistance and major causes. Then public health crises result in increased morbidity and mortality and economic disruptions. International cooperations, robust public health infrastructure and scientific advancements in controlling and preventing these diseases are need of the hour. So, in the historical context of emerging and re-emerging disease, major past outbreaks like these include the Black Death in the 14th century, the Spanish flu in 1918 and the HIV/AIDS epidemic starting in 1980s. These outbreaks had devastating impacts on the populations, economies and societies worldwide. So, lessons from history. Historical outbreaks have highlighted the importance of early detections, rapid response and effective public health measures. They have also underscored the necessity for international cooperations and information sharing. Evolution of public health response like development of vaccines, antibiotics and improved sanitation have significantly reduced the incidence of many infectious diseases. Establishment of global health organizations like the WHO to coordinate response to health threats have also helped a lot. Recurring challenges like despite advancement, new diseases continue to emerge and known disease re-emerge due to factors such as microbial evolution, human behavior change and environmental factors. Factors contributing to the emergence of disease. First one is environmental change, and natural ecosystems are disrupted by deforestation, urbanizations and agricultural growth, which increases human exposure to novel infections. Due to change being brought about by climate change, new illnesses are more likely to arise. Globalization and travel increased, cross-border travel and trade allow for the quick movement of people and products, which accelerates the spread of infections. Then outbreaks can result from the introduction of pathogens into previous undiscovered locations, and urbanization and population density, urban settings and with which population densities are prime locations for the quick spread of infections, illness. In urban slums, unsanitary living conditions, a lack of resources and dense population like density contribute to the spread of illness. If you know that deforestation and habitat destructions also one factor. When natural ecosystems are destroyed, wildlife and people come into closer contact. That also increases different types of disease, like raising the possibility of zoonotic illness. Urbanization is a very important factor, like inadequate sanitations and congested living circumstances brought on by rapid urban expansions might encourage the spread of different types of disease. So then we have also wildlife, like wildlife trade, the unregulated and illicit commerce in wild animals has also the potential to expose people to novel disease. Then also like technological advancement, for example, and technological advance like advances in medical technology such as invasive procedures can inadvertently introduce or spread infections. So in that sense also there is another factor which is very responsible, that is bioterrorism. So disease outbreaks can result from the deliberate release of hazardous biological agents, genetic changes in pathogens, and pathogens can like undergo natural mutations or genetic recommendations that results in the creation of new and more like drug resistance and like virulent strains. So then migration and displacement disease can also spread to the new regions because of migrations, and populations as a result of human migrations brought on by the economic hardships, natural catastrophes and political unrest. When they migrate from one place to another place, also some disease are where the place there is no disease, because of migration also that type of disease emerges. Then factors contributing to the re-emergence of disease, like for example lapse of immunity, that is also a factor, like disease can resurface in communities where immunity is waning over time, like because of a time span some immunity the community loses, and because of that also there is a factor to re-emergence of disease, either as a result of a natural reduction in immunity or from the lack of booster shots, that is also one of the factor. Then we have another very important factor which is behavioral change and also compliances, like declining vaccinations, reluctance or complicancy leading to a decline in adherence to vaccinations. If you do not have a vaccine, proper vaccine for a particular disease, that chances is there that that disease will re-emerge again. So like preventive interventions, or maybe if it is not successful, then there is a chance also. A reoccurrence of illness may be aided by behavioral shifts in society also, like such as decrease in the utilization of preventive healthcare service. Then we have also another very important factors which is humanitarian crisis, like natural catastrophe, wars and also conflicts that causes population displacement, for example because of any type of war, and sometimes also because of climate as a factor also, like people going from one place to another place, and interference with the provision of health care and also causes illness to resurface. And sometimes disease outbreaks can occur in overcrowded refugee camps with inadequate hygienic conditions and medical attentions, because normally if there is no medical conditions will be improved in a refugee camp, also because of them have their antigens within the body, pathogens within the body, that also from one place to another place this happens. Then agricultural practices, re-emergence of zoonotic infections might be caused by intensified farming methods and modifications in animal management. For example, different animals have different types of disease they suffer, and when it is contact with human body, then it is a chance. So then antibiotic resistance can be facilitated by the use of antibiotics in agriculture, which can lead to the spread of resistant illness. This also because of agricultural practices, the way practice animal involved in the agriculture. Environmental factor is very important. So environmental changes like deforestation, urbanization and natural catastrophe are example of changes that can upset ecosystems and cause illness to reappear by changing the habitat of the vectors. Like because of the changing deforestation, the vectors has changed, and because of that also sometimes these diseases are emerging. So then globalization of trade, when commodities and people are moved around more wildly, and illness that were once controlled or eradicated might reappear in previously examined places. Because if some people are migrating having pathogens or some disease within that, and when they are interacting with others, that chances will also emerge. Then we have also climate variability. The range and seasonality of vector-borne illness like malaria and dengue fever can be expanded by alterations in the environment, such as elevated temperature and also like changed rainfall patterns. For example, dengue is a disease. It happens in, for example, if we take the case of dengue in Delhi or any part of in India, it is sometimes it is monsoon and after monsoon also. And sometimes it has been, study has been found that if number of rainy days are like very frequent, I mean number of rainy days within a span of 15 days if more, then chances of dengue like breeding is very less. So then complicancy and resource vigilance like re-emergence of illness can result from complicancy and decreased attention in disease monitoring and control effects, especially areas where the disease was formerly common. Like normally there is a common pattern of disease, but it also re-emerges because of changing climate or increasing temperature or humidity, that also is a factor. So then emerging disease in India, let us have how different types of disease emerge in India. Okay. So taking one example, you might have known the Nipah virus. Nipah virus actually initially discovered in the West Bengal in 2001. So there were further outbreaks in Kerala. We have the cases of Nipah virus very recently also we have cases of Nipah virus there in Kerala. Human to human contact and fruit bat transmissions are the two ways that zoonotic viruses spread to the people. Because of bat they eats fruits, and because of that also that if sometimes it is through human contact, this also spreads. Then high death rate and serious public health issues necessitates the strict contaminated and surveillance protocols. Then another such virus, that is Zika virus. After Nipah virus, then you might be known about Zika virus, that causes reported from like cases of Nipah or Zika virus, like Nipah it is from Kerala, or similarly here Zika viruses cases reported from Gujarat, Rajasthan and Madhya Pradesh, like indicates that it was discovered in India in 2017. And also the dengue, like Aedes mosquitoes bites like carrying the infections are in the main method of transmission, and it is connected to neurological illness and birth problems, including microphaly like reoccurring public awareness campaigns and vector control measures. So like Zika, it's also Zika is very serious type of disease virus that affects human. Congo hemorrhage fever, which is with occasional incidents in other areas, like the disease was first noted in 2011 in Gujarat, and this virus carried by tick, that is also spread by coming into touch with animal tissues or blood, like tick bites, you can say tick bites, also tick bites sometimes in the animals, and the tick bites to the human, that extreme viral hemorrhages like fever with a high fatality rates calls for increased monitoring and workers' safety in the healthcare industry, because tick or flea or many mosquitoes, that is if not controlled. So sometimes it is if maintenance will be not taken care of, then it will be create a problem to the healthcare industry itself. It is another one, like in several Indian states, hantavirus causes have been rising, like in particularly in the rural regions with significant rodent populations. The virus can spread by inhaling dust contaminated with like mouse urine and droppings or saliva, because like rat for example, that also as a pathogen they carry this virus. It can also be contracted by coming into touch with these materials sometimes. Then another very another one virus, that is you can say Kawasaki disease, which is in first it was in Japan, then through pathogens it carried and it has already, there are cases in India, like India had a marked rise in the instance of Kawasaki illness, especially among like pediatric patients, like for small children, and though its practice causes is uncertain, like what are the causes, but Kawasaki illness is not thought to be communicable. It is not a communicable disease. It is believed to be related to an atypical immunological reaction to an infection or other environmental stimulus. So, like because of environmental stimulants, this disease is also coming. Then another like Kala Azar, which is very known to, I mean all this, I mean you might have heard about this Kala Azar, like with fresh cases and the potential to spread to non-pandemic, non-endemic areas, like persistence in certain endemic locations, it is dispersed by like sand fly bites carrying the virus and produce like fever and increase in body weight and splenic or liver enlargements and having major influence on the affected population, and if left unaddressed it may be deadly. So, this is also another like Kala Azar, which government we have also their precautionary measures for this. Then mycosis or black fungus. So, significant rise in instance during the COVID-19. I think you might have heard the black fungus. It is a very epidemic during COVID-19, and especially during the second wave it was very serious, especially in those with the diabetes and immunocompromised people like senior citizens, and also those who have diabetes, hypertension, and spores of fungi are present on the surroundings and can infect people through wounds and inhalations. So, there is a chance also if you are inhaling and some people is there through the air also it can come to the human body. Then re-emerging disease in India, like another tuberculosis for example, is a India has a greatest number of tuberculosis cases worldwide, like which we call it TB, like, and despite control effect, TB continues to be the serious public health concerns. Even at the village level also these tuberculosis cases are coming, and it is like even it is for maybe 30-40 years these cases are still there, and the emergence of tuberculosis strains that are extensively drug resistant, and because of if you early detected tuberculosis is curable. So, that hampers the treatment and control, like the elevated incidence of illness and death and noteworthy influence of public health and socio-economic implications. That is also major factor, like when tuberculosis is there, if you detected early, maybe there are primary health centers, they are also giving this drugs or medicines to cure the disease, and if you neglect maybe it will be very dangerous. Then we have another disease which is malaria, like reoccurrent of outbreaks of malaria, particularly northeastern areas and states like Orissa and Chhattisgarh. Also it is very serious because of this is a tribal dominated area, and sometimes people are not that aware about this disease, and even if they know the mosquito bite malaria is there, but still they are not taking care of it. So, both modifications in mosquito behavior and resistance to pesticides and anti-malarial medicines, it is very necessary to have control this malaria, like major source of illness and death mostly in practicing communities living in rural and tribal areas. Why this is happening in the tribal area most of the time? Because people are not aware. For example, using this mosquito net during sleeping, they are not doing that. So, that also one factor also, like such cases are increasing. Then we have dengue fever, like dengue outbreaks are becoming more frequent and severe in India and India's urban and semi-urban areas. It is not only in Delhi, also in all the parts of the India, most of the cities they have emerging cases of dengue, okay, and growing like pesticides resistance in the mosquitoes and lack of effective vaccinations, and if early detected, if it is very curable, and if it is like you delay something or you never visited because you thought it is a not that type of disease. So, high incidence of like this disease are very severe cases of resulting the dengue shock syndromes and dengue hemorrhage fevers, like people are also that causes death because of dengue, it is a very serious also. Then leptospirosis, like this is the epidemics that often causes like during monsoon seasons, especially in the places like Gujarat, Kerala and Maharashtra, and poor sanitation, excessive rodent populations, and lack of awareness and appropriate diagnosis is the one of the factor that have emerged this disease, and it has high rate of morbidity and death, with severe instances resulting in like renal and liver failure because of this disease. Brucellosis. Brucellosis, like brucellosis, an increase in the instance in rural regions as a result of like unpasteurized dairy products. For example, you are using milk products which is not pasteurized, you are drinking it, so then you have a chance of getting this disease. So spreading from animals to people, and transmissions via unpasteurized milks and consumptions or animal contact with affected individuals, that is also one of the factors. Like sometimes without pasteurization you are drinking directly from the animals, and that type of also increases this rate of this disease. Then produces like symptoms similar to the flu and has the potential to cause long term problems, and once if you avoid this, like not drinking any unpasteurized milk, the chance of that you will not suffer this disease, including liver damage and also sometimes like arthritis problems in the joints and all this. Then diphtheria, a decline in vaccination rates and a reduction in public health initiatives have been linked to outbreaks of diphtheria again. So like we have this type of vaccines to the pediatrics departments in medicine hospitals. So transmitted via an infected person's respiratory droplets causing severe throat infections may cause systematic poisoning and blockage of like airways. Then we have filaria, like that is inadequate vector management and treatment exaggerates like the persistence of cases in endemic locations. It is transmitted by mosquito bites, especially those from the Anopheles and Coralex species, causing elephantiasis and persistent lymphomanic oedemia. So where is you have elephant legs type symptoms are there, eye features. So although widespread medicines administered has contributed to its control, and new instance of continue also arises. Like then we have another disease which is the tetanus. You can say any we know that anything happening, cutting or something, we have to like some immediate having any wound because of cutting, we have to get that. So though not contagious, illness results from bacterial spore getting into wounds. It causes extreme muscular stiffness and spasms that it left untreated might be fatal. And global perspective on this emerging disease, like what are the global perspective, like geographical spread, emerging illness can start in one area and spread around the world. As COVID-19 we have already seen, one area it was emerged, then it is spread globally. So pandemic has demonstrated decreased transmissions and also sometimes also very seriously increased transmissions, like commerce and travel allow the disease to spread quickly between different continents also. Okay. So global health security, like the global health security is seriously threatened by emerging illnesses, so that necessitated the concrete or international actions. We have like WHO for example, that matter around the world. Agencies such as the World Health Organization are essential for tracking, adverting and managing this type of global epidemics. So then emerging illnesses have the potential to have catastrophic effects on the commerce, global markets and travel and healthcare systems. Indirect like expense like loss of productivity and tourism income are included in the economic burden. So that we have already seen during the pandemic also. In addition to direct healthcare expenditures, because when this type of pandemic is there, you have to only spread to save your people. So technological and scientific advancement, like for the purpose of identifying and managing emerging illness and developments in genetically like genetics and diagnosis and also vaccines development are essential to control this type of disease. Then what are the scientific collaborations, research collaborations on a global scale, so that this expedite the development of different therapies, or how this has been introduced in the to cure the disease. So that preparedness and response improving early warning systems and forfeiting like international monitoring networks are essential for prompt response to a new illness. The management of global health concerns requires fair access to healthcare resources, like for example capacity building, like you have to be ready for the like medicine systems, or those who are working behind it also you need that to strengthen. And in low resource areas and also international cooperation, for example global perspective on re-emerging disease, like increased disease resurgence, a number of once controlled illness, then including measles, malaria, TB, are making a comeback as a result of things like antibiotic resistance and vaccination gaps. So that is a global perspective, how these emergence of disease are coming. For example, global travel and migrations contributed to the reappearance and spread of this illness in locations where they were formerly like eradicated. Similar conditions like impact of climate change, dengue and malaria are making a comeback in new areas due to change in the distributions or behavior of the disease vectors like mosquitoes and brought on by the climate change. Climate change is a factor also like dengue and malaria. So re-emerging illness are facilitated in their spread by extreme weather events and environmental changes. So in that condition, like you have, what are the challenges then for the public infrastructure to control this disease? Like controlling and eradicating re-emerging illness is hampered by the inadequate healthcare infrastructures, particularly like in low and middle income nations. So they cannot provide much for the infrastructure, and further like weakened by political unrest and armed conflicts and economic hardships, which makes it harder to maintain disease control initiatives. So also for that matter global cooperation and policy is necessary, like coordinations of policies like resource sharing and international cooperations are necessary for that effect. For example, during COVID-19, Indian government help other countries also to have give the vaccine for this COVID-19. So like control of re-emerging illnesses, for example governments and non-governmental organizations and global health organizations must collaborate to enhance disease surveillance so that it is very easy to monitor. So expand access to vaccination, so all the people should be vaccinated because of that, and treatment and provide strong support for public health programs. Then how this impact of emerging and re-emerging disease, for example public health crisis notably rise the incidence of morbidity and death or overwhelms healthcare systems leading to resource shortage and decreased quality of care. And then because of that also you have economic burden, like if more cases of disease are coming, economic burden will be there. So high expenditure associated with medical care, hospital stays and vaccinations, that is a factor also. And productivity loss brought on by disease and like quarantine restrictions, which has an impact on the whole economy, we have seen. So social disruptions like lockdowns, travel restrictions and school closure throughout everyday schedules, that also has contributed to this economic burden. The possibility of quick cross-border spread necessitating international cooperations in response. Then we have like what are the global health security threats. Possibility of quick cross-border spread necessitating international cooperation in response is very, very important. So places like a strain on resource for global health and emphasize the necessity for reliable mechanism for surveillance and response. So that is an essential component. Then impact on vulnerability of populations, like impact marginalized and low income populations. So disproportionately and with health or little access to the health care. So exacerbates already existing inadequate and widens the gaps in the health outcomes. Psychological impact, for example, elevated tensions, worry and mental health problems as a result of social isolations and infections, fear. So long term psychological impacts on these impacted by epidemic both individually and the groups. Okay. So then challenge in the disease control, then what are the challenges you have to control the disease? The emergence of antibiotic resistance makes effects at management and therapy more difficult. So the development and efficacy of vaccines are implicated and very complicated by the virus, like frequent mutations and adaptability. So, impact on global travel, that has serious impact on global travel, and international trade and tourism are disrupted by travel bans and trade restrictions. Then also financial loss in sectors of economy depend on the supply networks and worldwide mobility, like we have during COVID-19 we have already experienced every whatever we are discussing now. So, strain on public health infrastructure, it is a very serious strain, like public health systems are under intense pressure to monitor disease and conduct immunizations campaigns and respond to the emergencies. So, causes of larger like burden on the health systems by taking funds away from the other crucial services, health services. So, what are the need for the policy and governance? So, like emphasizing the significance of robust governance structures and public health policy. We have seen like how the vaccination has been distributed for during the pandemic very quickly within short span of time. So, investment in health infrastructure, research and international collaborations are required, and technological and scientific advancement like genomic sequencing, the genetic identification and characterization of pathogens is made possible by rapid sequencing methods. It aids in the tracking of disease transmissions, like the comprehension of mutations and development of specialized medicines for vaccines like for particular disease. Then we have also vaccine development, like the development and administration of vaccines for newly developed illness like COVID-19, which we have already discussed here, and have been like expedited by the developments of vaccines technology, like particularly like RNA vaccines. A faster response to newly discovered and re-emerging disease is possible with enhancement of vaccination platforms. Then what are the diagnosis, like creation of quick, precise and responsible priced diagnosis tools are very important. In rural and low resource environments, accessibility has improved and the point-to care testing are very important. Then for example, we have data analytics and artificial intelligence, big data and artificial intelligence applications for disease propagations and modeling, epidemic predictions and public health response optimizations are very important. And now we have also telemedicine concept, like telemedicines through telephonic conversation also you can have medicines prescriptions you can take, and technological scientific advancement also, like personalized medicine, personalized treatments and strategy based on the individual genetic profiles are now possible because of advancement of genomics and nanotechnology. Okay. Then what are the surveillance systems, like the early identification and also response to epidemics are improved and by real-time data sharing systems and enhancement global disease monitoring networks. During COVID-19 also that has been effective very much. So, then antimicrobial developments, like investigation into novel antifungals, antivirals and antibiotics to fight drug resistant strains, and new therapeutical like techniques like CRISPR and based antibiotics and also bacterial phage like therapy presenting promising possibility to cure disease. Then public health information technology applied to enhance the public health data collections and management and analysis, and also health information exchange, like when COVID was there, health information, like how many people death, how many people affected or infected because of that type of data you have that, then also it helps to monitoring. Then biotechnological innovations, like creation of cutting edge biotechnological technology to research for infection and create new treatments, such as different types of gene editing tool, synthetic biology for developing novel vaccines and diagnostics of instruments, as well as for modifying microbes to combat illness. So, there are many challenges for that also, like antimicrobial resistance. The treatment and management of illness are made more difficult by organisms growing medication resistance, like for example global surveillance and early detections. How will do that? Like in many areas, insufficient surveillance methods make it difficult to identify epidemic early. So, if that is the problem, then you couldn't identify them, it is very difficult to monitor. So, vaccination hesitance like disease control is hampered by vaccine skepticism, or maybe you can say misinformations, which like lower immunization rates. So, then sometimes like political and social instability, like social turbulence and conflicts, like impede public health initiatives and accelerate the spread of illness. And then urbanization and also population growth. The danger of disease transmission rise with rapid urbanization and population density. Like if some disease has been occurred and there is a high density population, then it spreads very very in a small time it spreads to the large number of people. Then what are so challenges are like healthcare infrastructures in many areas. Lack of proper healthcare infrastructures makes it difficult to contain epidemics. Okay, so funding and also resource, like how the restricted resource for research on emerging illnesses and public health programs. Then we have international collaborations, which already we have discussed, like effective disease control at the global international cooperation level, and also we have public health workforce, like dearth of quality public health specialists, or funding like courses and training and creating capacity building, so that people should be always in the medical systems, they will be ready. So policy and governance, like inadequate governance, structure and strategy for handling medical crisis, and organization involved for these type of things, global body like a government of India, international NGOs, Indian NGOs bodies, and then we have World Health Organizations, Centers for Disease Control and Prevention, and we have Global Fund to fight AIDS, tuberculosis and malaria research, and also like International Federation, so Red Cross, Government of India, Indian Council of Medical Research, National Center for Disease Control, and Ministry of Health and Family Welfare. So then National Institute of Virology, and like medicines, Doctors Without Borders concept, like path, like we have different NGOs at global level, for example Melinda Gates Foundations, we have Save the Children. So there are many such international organizations which are working for this, and also we have many such, you might have known, like Sustainable Social Environment and Ecological Development Society, Public Health Foundation of India. So we have many such so we have many such case studies where people, NGOs, international NGOs, regional level or international level, they are working for this, like also we have international bodies. So how they are working for this, like we have a case study here, you can see how the COVID spread and what are the situations that time when Government of India also very active to have a particular response to control this. So then we have like other types of like how to monitor and what are the vaccination processes, like epidemic vaccines, including those from like different types of companies, those who are producing these vaccines through their research to control this disease. Also that is very important to strengthen the research base who is producing the vaccine. That is also one of the factors where in the low developed countries they cannot do this. So in another case studies, we have emergence of disease in India, like Nipah virus, which we have discussed, that how it is 1998 to 99 in Kerala, and then it has been as the Nipah virus initially appeared in Malaysia and Singapore, then coming to the Kerala because of people are migrating in that area. So this is also another factor, like if you can see detail in the, like death in the like Kujikudi area led the identification of first instance of Nipah virus. So this is transmitted from one people to another people, then people like government is very serious about that, how to control that. Okay, so then we have like response in response to the World Health Organization or National Control Disease, we have like and the Kerala government, they have planned properly, so how they can control this disease. So we have like when this type of virus coming from the foreign country and this the infect populations in India or any other countries for that matter, so you need to strengthen this very seriously. Then another case study number 3, we have re-emergence of disease in the world, like measles outbreak in the United States in 2019. So that also it's a country like USA, which is a very developed country, but still the re-emergence of malaria with 1282 confirmed cases of like malaria incidents in 2019 in USA. So like even if like misinformation and mistrust of medical authority are the main causes of vaccines reluctance and increased worldwide travel, which has caused different types of measles. So what are the response? Even widespread immunization program were started by the public health officials, focusing on the impacted areas with low immunization rates. Okay, then campaigns for education and information were stepped up to overcome vaccine reluctance and highlight the advantage of immunization. So what are the outcomes because of that? The epidemic made clear and how crucial for this, and it spurred new initiatives to improve vaccination camps and also deal with false informations about vaccinations. So there are some like people who are not ready to get the vaccines. So another case study like re-emergence of disease in India, like re-emergence of malaria in Odisha. Odisha is very mostly the western Odisha particularly tribal dominated, and because of that people are not hesitate to go for the like mosquito net to see. So that is also another factors, and also we have like even while the frequency of malaria has significantly decreased certain areas like Odisha, still we have the like recurrent of outbreaks. Incidents like malaria appeared in Odisha in the late 2000 and early 2010, especially rural and tribal areas. Okay, what are the challenges? The high rate of malaria is isolated and difficult to reach places with inadequate medical facilities. The issue was made worse by socio-economic reasons like lack of education, poverty, and also subpar living conditions. Okay, so inconsistence of application and preventive healthcare systems in the tribal areas, that because of that it is again coming re-emerging of disease. So what are the response? Government of Odisha are taking many through Ministry of Health and Family Welfare, they are taking like long lasting measures where they can control this disease. To guarantee the prompt diagnosis and efficient treatments, the use of anti insulin based combined treatments or maybe RDT treatments was increased to control this disease. So outcome, like as a result of this coordinated effects, like Odisha saw a notable drop in the number of malaria cases and fatalities. In comparison to 2017, the state recorded 80% decrease in malaria incidents in 2019. So within 2 years. So to have this type of preparedness, so if you have to control a disease, to maintain the progress and stop replace the future surveillance and prevention and treatment must remain priorities. So in the conclusion, environmental changes and climate variability drive disease emerge globally. Urbanization and high population densities in India and beyond exacerbate the infections, then global mobility, fatalities and rapid international transmissions by the disease. Then also strengthening healthcare infrastructure is essential for effective disease control and prevention. Then geographical and socio-economic disparities significantly influence disease burden and outbreak response. Then we have lessons, whatever lessons we have learned, like managing newly developing and re-emerging illness requires resilience, rapid judgment and readiness for this monitoring purpose. So in order to prevent disease, community involvement and public health education are very essential. Now what are the way forward for this type of cases? So like placing a strong emphasis on a multifaceted strategy that include public health programs, policy development and scientific research, reducing effect of upcoming disease like epidemics by constructing strong healthcare systems and encouraging international cooperations, which are very essential for this. So from this lecture also you have known how these diseases are emerging and re-emerging and what type of vaccinations we need to control this disease. So here also we have provided some references, books and websites where you can learn, you can have some readings for that. And thank you all